Shockwave therapy can be an incredibly effective tool for treating your shoulder pain, but it's not right for everyone. And in this video, I want to go over who it's for, who it's not for, and how do you decide whether the shockwave therapy is right for you. The first step is figuring out where your shoulder pain is coming from. Your shoulder pain can come from all different areas in your shoulder. Specifically, it can come from either your labrum, which is located inside your joint and gives your shoulder stability. It can come from tendons, your rotator cuff tendons, so you may have a tendinopathy, tendinitis in those areas. You may have a small partial tear in some of the rotator cuff, or you can have a full thickness tear in your rotator cuff that can prevent your shoulder from moving well. So depending on what kind of injury you have, that allows us to figure out if shockwave therapy is even helpful for you. So who's the right candidate for shockwave therapy? Research shows that those with tendinitis and those with small partial tears respond really well to shockwave therapy. Tendinitis usually happens as an overuse injury. So if you jump back into exercise too quickly, or if you load your tissues too quickly, tendinitis may occur, and shockwave therapy is super effective at speeding up that healing process. With small partial tears, we find that shockwave therapy is effective as well, mainly because it speeds up the healing process for those tears to heal. Tears are kind of normal as we age, and research shows that with conservative treatment, these partial tears heal really well without even needing surgery. So who isn't a candidate for shockwave therapy? Research shows that those with full thickness tears and labral tears don't respond well to shockwave therapy. A full thickness tear is when one of your rotator cuff tendons are fully ripped off the bone and you lack the ability to even move your arm or lack the strength to even move your arm. Labrum is located in your shoulder joint, and those with labral tears have a ton of instability or constant dislocations or subluxations, and those people typically don't respond really well to shockwave therapy. And that's why knowing the root cause of your shoulder pain really helps us decide whether shockwave therapy is right for you. Along with shockwave therapy, we find that physical therapy and proper strength training is essential for us to get your shoulder back to 100%. Shockwave therapy really helps at getting down to the tissue level and speeding up healing there. But it doesn't really fix the compensations that you develop that cause your shoulder pain. A lot of times we have patients that come in that sometimes their shoulder pain, or that tendinitis or that partial tear was caused because your lat was tight or your mid back was weak when you're lifting, or you have overactive upper traps. So really fixing that true cause of that shoulder pain is essential so that your shoulder doesn't get back to being irritated or that tendinitis from flaring up again. So if you found this video helpful, please share, or if you have any questions, feel free to comment below. We'll love to help you guys out.